Okay, hello everybody. I think this is the final presentation here of the morning session. These have been kind of eclectic presentations, but I'm going to follow up a little bit on Allison's work and talk more from a psychology side of promoting physical activity, which is kind of how she left it about the importance of people not doing enough physical activity. And so just as a basic outline, I'll start with a bit of the preamble on why we study physical activity and how we're doing. And then today, I'm going to focus on some of our work from our lab on parental support of child physical activity, and then finish with some of our future directions and the challenges in this area. So just before I begin, so I'm the director of the behavioral medicine lab over here at UVic. This lab started in about 2002, I think, so it's been going for a while. Fortunately, I was able to get one of those big CFI grants and get things going early. And now it's a complement of about 15 to 20 research personnel at any given time in the lab. And of course, it's always changing. And I thought I'd put this picture up here, as you can see, because many of our meetings in the last couple of years, just like everything else, has been over Zoom. So you can see some of the complement of the lab personnel there. We do lots of different work in projects, mainly behavioral science projects around physical activity and sometimes healthy eating, sleeping, and helping to curb sedentary behaviors. And so today I'm going to talk about some of our targeted family research. This is where we have some of our larger grants and the work we do. But even then, it's sort of a life course approach that we take. So we have work that starts with intervening with the the experience of becoming a parent. So starting with pregnancy and moving all the way through having tots and working with co-physical activity between parents and tots, to all the way to the end of almost empty nesters. We have a study with empty nesters looking at when kids have left the house and trying to get parents active after that entire experience. So we do have kind of a life course approach in the family. What ties together most of this research is our theoretical framework and the work that we try and do and how we promote behavior change with our groups. And so this all often involves all kinds of explanations, from social cognitive type work that I'll talk about today, a little bit into habit formation, and quite a focus on what's called the intention behavior gap. And many people who are listening will know this by New Year's resolution. So this idea that we try to make changes and they quickly don't follow through. And so we focus quite a bit on how to actually follow through with the best of intentions. And you can see here, there's a picture of a dog, because we always have some type of project on dogs and physical activity because it's such an interesting area. All right, so, the benefits of physical activity are pretty compelling. Honestly, if you could turn physical activity into a pill, it would be the most prescribed medication on the planet. Inactivity is associated with at least 25. I think it's actually up climbing to about 35 chronic conditions. That includes bone health and muscular health, which Allison brought up, but also, as you can see, lots of other chronic diseases, from metabolic disorders to cardiovascular disease and many cancers. And also many psychological conditions as well. So it's certainly very compelling. But why families? Well, there's a couple of important reasons. So one is that what we do in our childhood tends to track to what we do in our adulthood. So starting young and forming good attitudes, good motivation, healthy quality motivation, as well as habits and a sense of identity can be very important to health behaviors such as physical activity. And the other is that children spend enormous amounts of time within the family structure. And so it actually can be quite an efficient place for physical activity promotion, because you can look at promoting the entire family system into healthy behaviors such as physical activity. There are also some benefits to family physical activity. They're outside of these health benefits I mentioned that I wanted to raise. Physical activity also appears to be very helpful with family functioning, which is, of course, important in its own right, particularly in areas of cohesion as well as family organization. It's not a panacea for every family functioning issue. It certainly didn't seem to have very much in our latest review on the affect environment. There's some areas of family functioning that physical activity programming doesn't improve, but ultimately there are certain areas where it's quite compelling evidence that it can improve the functioning of the family. So given all these benefits, one would expect that we're all out there being active, but I think probably everyone in the room or the virtual room knows that that's not the case. Unfortunately, child physical activity is an ongoing concern. As you can see across the world, almost no country is really engaging in physical activity at the recommended levels. Here, for child physical activity, it's generally recommended about 60 minutes of moderate to vigorous intensity physical activity per day, at least on average. And as you can see, only a couple of countries are even in the B category, meaning that they're starting to get there. Most countries are sort of in the failure rate, meaning that these rates are down around 15% of our population meeting those recommendations. And this has gotten worse during the pandemic. So we, as a group, published a few papers right off the bat when we had pandemic restrictions showing, and I don't think this will be too surprising to anyone, that movement behaviors such as physical activity were down for kids and youth, and screen behaviors were through the roof. And so this has been an ongoing problem. We now have published a second paper, and we're actually working, I just did the analyses for a third paper as we look across every 6 months of these restrictions. And it's bounced back a little bit, but we're still beneath those very dismal reports before the pandemic started. So it's even more of a concern at this point. And, you know, kids are not alone in this issue with physical inactivity. It also affects the parents. In fact, in some of the work from my lab, and we had a relatively recent review that tried to look at all socioecological type predictors of transitions of physical activity, and we found that the onset of motherhood was the #1 predictor of inactivity in comparison to anything else that we could come up with in terms of what's been studied. And so it's particularly concerning. And the onset of fatherhood for most studies is not far behind that either. And so parenthood often, because of the time demands and the new challenges, parents themselves will give up their own leisure time behaviors to meet that. And as a result, inactivity is at the top of the list. This is just some of the research we've done looking at this. A particular concern is sort of that bottom light green quadrant, because these were moms who, before they had kids, were meeting the physical activity guidelines for adults, which was 150 minutes of moderate to vigorous physical activity per week. And as you can see, 35% of moms who were active never returned after 5 years in terms of those activity rates. So that's alarming, because we know that physical inactivity is already quite prevalent, but when people are giving it up, that's particularly concerning. And of course, there's an understanding that maybe within the first 6 months or so, you know, there's going to be enough challenges that maybe it's hard to meet those rates, but 5 years later is very concerning. And we followed through with that type of cross-sectional design to look at this with objective monitoring of physical activity. So these were cohorts of parents who are second-time parents, new parents, so first-time parents, as well as just couples without kids. And we followed them actually in this particular study for 24 months. And wanted to look at what happens. And this was, again, with an objective monitor. So we had an accelerometer on people, so it wasn't just the self-report component of physical activity. And we were able to show here that, as you can see, second-time parents are already less active than the other groups. And we did see, even in the first 12 months, the dip with new moms. We didn't see it with dads yet. So it appears that, and some of our further research has shown that dads often get hit in the second wave. So with the second child, as they switch from zone to man, so to speak, in terms of child support. So what we're seeing there is definitely a concern. The other thing we noticed in these data is that there's a relationship between the parents. So you can see even within the family system of parents, that parents who become more sedentary together, and those trajectories are tied and correlated. Okay, so why are families not active? Well, I've given a few hints, but you know, often the benefits are heavily promoted, and I did this at the start of the talk. I talked about all the great things about physical activity, but the realities of having a family is more like this. At times, let's be honest, it's not all sunshine and rainbows. Kids often want to do different things than their parents. Their parents have other activities they're trying to achieve, and so it can be very, very challenging. And so it's really important to take a family systems approach and an ecological approach to understanding child health and family health. And this particular diagram is meant to look really busy and complex because it's meant to actually show what it's like to promote health within a family system. And so this was from a couple of years back. I was a leader of, I think it was 35 different stakeholders across Canada, where we developed a consensus statement on health behaviors in the family. For the rest of the talk, I'm just going to talk about the small one that says parenting practices right below the child there. So we'll talk about the role that parenting practices may have in promoting physical activity, but don't lose sight of course, how complicated this really is with all these factors. So in terms of parental support, there's very good evidence why we would focus on this. My group has had a few different reviews and meta-analyses over the years showing that parents are often the gateway to child physical activity. Of course, it's interactive to a certain extent. Anyone who's been a parent knows their kids can push back or can push them in different directions. But ultimately, more than just modeling good physical activity, we know that supporting physical activity is important. What does support actually mean? Well, it's a multi-component construct. It seems like the big three factors are encouragement for the child to be active. So setting a good example with regular encouragement, logistical support, which means often driving the kid or signing children up for different activities. So being there to be sort of the person who helps enable physical activity. And then particularly with younger children, co-participation. So actually getting out and facilitating physical activity as a family. This starts to dip, of course, around the age of 10 to 12, where logistical support becomes the core factor. But you can see there are other issues here too, as well as facilitating a home environment for physical activity, providing information, spectating at child activities and things like that, all provide different supports. Unfortunately, just like physical activity itself, support for moderate to vigorous physical activity is quite low among parents. When you look at light physical activity support, that's what that LPA is. Certainly sleep, support for healthy sleep for children is much higher. It's at a much higher level, as well as even support to reduce screen time. So physical activity support is something that's often not practiced, even though it's so linked to child physical activity. So one of the things we do in our lab is look at whether we can promote physical activity through parental support. And, the basic answer is yes, overall, we've been able to do this in the research community, but there's sort of a tale of time. So a lot of our initial studies were finding that we weren't able to modify family support patterns, and some of the newer studies are starting to show that. The effect sizes are modest, meaning that we can make small changes in the lives of families, but meaningful. And really, it's a tale of two different approaches at the moment. So I just want to highlight those approaches before I stop today. So the first approach really dominated, I'd say, the last 20 years up until, I'd say, about 2012 or so. And this is sort of this rational approach to physical activity. It's kind of the public health approach where if we can just educate people about all those benefits you saw in one of my first slides, people will have positive attitudes that this is a good thing to do, will intend to do it, and then we'll go off and actually engage in physical activity. What we find is there's some immediate issues with that. The first is that most people already know physical activity is good for them. As you can see here, this was a sample of Canadian mothers, and they either ranked physical activity as the #1 priority for their children, or the #2, where homework was ranked as #1. And in fact, it's surprising how highly it was ranked, because many of these other factors are also very important, such as music and socializing and even family time, but they were generally ranked lower than physical activity. So clearly there's already this sense of, yes, this is an important behavior to promote. The other factor is this infamous intention behavior gap. Most parents already have positive intentions. So to look at this quadrant, you could imagine you've got intend, don't intend to support child physical activity on one axis, and whether you followed through or you didn't follow through with physical activity. So with your support of children with physical activity. So you can see there's about 1/3 of the sample didn't intend to and didn't follow through. So they were congruent with their intentions, but in a way that we don't like to see. The more interesting issue is the group of unsuccessful intenders. So this is a group who wanted to follow through with support in some way, but something happened and they fell short. So you can see in that kind of rational approach, there's quite a few people who may intend to do something, but they're failing to do it. So this speaks to the other tale of how to intervene. And this is looking at how to build self-regulation skills for parents with support. So this is coming on the other end of intention, and it's coming under the assumption that many people want to make these changes, but need to be equipped with ways to do it. So some of our studies have looked at how we can help make families and parents master planners, looking at how we can set reminders, develop cues, as well as set action plans and help cope and problem solve around the issues in the family. And so we've had 2 randomized controlled trials looking at this. So these are experimental designs where the control group gets the rational education approach, and the intervention gets a little bit of that education material, but then ultimately gets sort of a workshop in how to plan and how to set goals and how ultimately to overcome barriers. So the first study was a much shorter design, it was only 1 month, and the second study was 6 months long, and the second study also used objective monitoring of physical activity, so we had accelerometry. So you can see the results from this first study were promising, showing that physical activity was higher for the self-regulatory group, that planning group of parents, and intention didn't matter. And this is, again, speaking to that intention behavior gap. These people are already intenders, so there's really nothing to change there. They've come to the trial with these decisions in hand, and what parents need is some strategies to help them. And then we followed up with a second study on this not too long ago, showing again that the planning group showed more effective physical activity changes with children. You can see it kind of dips over 6 months. We stopped the intervention after 12 weeks to see what happens if people actually could do it themselves, and you could start to see a return to baseline. And so in terms of future directions, we're going to follow up on what we have here. So far, we've really been focused on what they call explicit, deliberative, or slow processing in human behavior. This is developing attitudes, developing good intentions, helping to problem solve and set goals. But our next series of studies are looking at other parts of how behavior is performed, and that's usually more automatic or fast factors. And the 2 that we're looking at is identity, which is self-categorization. So the idea here is that often when we self-categorize that we are something, there's a tremendous amount of affect associated with being discrepant with that. It's called cognitive dissonance, and it's its own motivator. So if families can actually become an active family, this may be a very strong motivator beyond just the educational approach. And the other is habits. And sometimes the word habit gets misused, where it means just sort of behavior, repeated behavior, but habit is actually a psychological construct, and it's behavior performed from cues. So it's a behavior that's been so rehearsed that the cue itself will determine a behavior. And I think you can probably think of driving behaviors as a classic example, where you get in your car and you're going to a destination and you can think and do a bunch of stuff and then you arrive. And so all these format executable functions have happened where you've gotten there. Sometimes morning coffee or morning other things are more habitual than anything. They're not really decided, they're just you're responding to cues. And so we've been looking at whether we can do that with physical activity. And so our ongoing research in this area is in particular to study habit and identity in comparison to self-regulation strategies and education. So we're going to have now 3 group randomized trials looking at what types of strategies help parents best. And we have longer trials with objective monitoring, and these are almost coming to an end. So I'm excited to find out what happened in these trials. So in summary, few children, unfortunately, are active enough, and neither are their parents. And so we do have quite a crisis here, because physical activity is so important to both health, as well as we're learning important to family functioning. And families are critical to this promotion, but it's extremely complex. It's a complex dynamic system. We've been studying, as I've shown, a lot around parenting practices, but it's only one piece of the puzzle. And so some broader ways of looking at this may be important. And finally, so far what we know is that overcoming that intention behavior gap is a mix of regulation skills with some solid attitudes, but we're looking into more complex systems of reflex-based interventions in the future. Thank you very much.